that in Vermont. I'm the president of Vermont Federation of Nurses and Health Professionals, which is part of United Professions of Vermont, AFT, and we're the third largest union in the state of Vermont with about 3,500 members. We are also proud partners with the Vermont Workers Center and the Healthcare is a Human Right campaign. Thank you for coming today. We're here to kick off this new legislative session with a loud and clear message that healthcare is a human right, and today is day one in building a people's movement to establish a universal healthcare system in Vermont, and by doing so, help lead the way to finally having universal healthcare in this country. We are here today because the healthcare system in Vermont is broken. Every week, I hear about patients that are critically ill because they didn't get help when they should have. Some of them die. Many lose their homes and have to choose between treatment or food for the family. We also know that people who have health insurance are suffering because they cannot afford the increasing costs of premiums, deductibles, and co-payments, and are denied care by the insurance companies. My own hospital is slashing necessary services, including preventative ones, working hard to cut healthcare worker positions, selling off a piece of itself that provides critical dialysis services to an out-of-state for-profit company, incentivizing physician compensation so that they are rewarded for bringing the hospital profit, not for bringing people health. That is why we are here to bring change. The Healthcare is a Human Right campaign believes that we need public policy that treats our healthcare system as a public good, not as a collection of commodities that can be bought and sold. We believe that we need a healthcare system that provides everybody access to healthcare that they need, that we have a system that excludes nobody. We are ready to move forward now toward leading the nation and having a universal healthcare system in Vermont.
Yes.
The petitions that we are delivering today read, we call upon the 2011 Vermont legislature to enact into law the healthcare system called for in Act 128, which was Senate Bill 88, a system which will serve all Vermonters according to their health needs, which will share its costs and benefits fairly, and which will fully satisfy the human rights principles of universality, equity, accountability, transparency, and participation. Woo.